This is Fox 26 Morning News at 9 a.m. Connected to you.
Good morning, everyone, and thank you for joining us. I'm Melissa Wilson.
And I'm Mike Yiskovitz.
Looking for ways to appear more radiant in the new year, dermatologist Dr. Sherry Ingraham with Advanced Dermatology is here with 5 manageable resolutions for preventing the look of aging and skin cancer. We like this. I like small lists that we can really make manageable in our lives. So let's start from the very beginning. Monthly self-exams, important to make sure that you don't have skin cancer.
Right, and we spoke about this before on this show. One of the easiest things you can do at home is look at yourself in the mirror. Take 5 minutes once a month and look at yourself from head to toe. Look at the palms, the soles, and then of course you can have someone else at home look at your back. But that's the way I find many patients discover things because they know their skin better than anyone.
But then a doctor can take a second look and really figure out if there's something perhaps in those hard to see areas. So is it important to schedule a cancer screening?
Absolutely. I tell patients once a year schedule a screening with a board certified dermatologist, especially if you have a history of skin cancer or a family history. But during the intermediate period, look at yourself, have a spouse or a loved one look at you as well, because that's how you're going to discover things early. Skin cancer is preventable if caught early.
At what age do people need to start really taking a look at their skin?
You know, I tell patients typically, because I'm asked that a lot, once you're in your teenage years, you can really assess and remember, and you're getting more sun exposure. But I certainly have patients with young children or with a family history of skin cancer. I tell parents, you're applying sunscreen, look at your children, notice any marks, any moles, look through their scalp, and then watch them over time. They should grow as they grow in proportion to them, but they shouldn't grow or change suddenly.
We always hear about it's so important to wear sunscreen, but at the end of the day, it really is. What about this time of year when it's cooler outside? You don't really think about it, but that sun's still shining down on us.
I think it's a misconception. I tell patients, did you put your sunscreen on today? And they say, no, it's wintertime. The sun shines every single day. We're exposed to it and we're wearing less clothes in the summertime, but we really need to be vigilant about daily sunscreen, especially in the winter on the face and the neck.
And also when it's even cloudy outside, right? Because those rays are still coming through to us.
We often see patients getting burned. You're still getting those UV rays. They are still penetrating.
What about a retinoid cream? You want us to wear that?
Absolutely. So retinoids are vitamin A derivatives. They are creams that we use as a cosmeceutical, but they also have some chemopreventative effects, which means they have been shown in some studies to prevent the development of atypia in cells. So they can help prevent the formation of precancers and skin cancers, but we like them a lot of times because they help the formation of wrinkles from occurring, and they can also help with kind of a ruddy complexion, brown spots. They help increase cell turnover.
Is that something you can get in a pharmacy or in a grocery store, or do you have to get it through a dermatologist?
Absolutely. So there's retinol, which you can get from a grocery store, or you can get some of the higher strength retinols at a dermatologist's office, or you can get prescription tretinoin, which is going to be more effective, but a lot of people can't tolerate the retinoids in the stronger categories because they can cause a little peeling and irritation. So find something that works for you.
We're out of time quickly. Skin healthy foods we can eat.
Okay, so the big 3, pomegranate juice, green tea, and vitamins. Get the vitamins on the skin and eat those antioxidants.
Dr. Ingraham, thank you for being here. Happy New Year. We'll start it off good now because of you. We'll be right back.